My name is Scott Spivey Provencio. You can call me Dr. Scott. I do both adult internal medicine and pediatrics at Settlement Health in East Harlem. We're located at 106 and 3rd. We're going to talk about sleep apnea today. We're going to kind of go a little bit into depth of what it is exactly, how to get evaluated for it, who should get evaluated, why does it matter, and what does it do with other respiratory problems. So what exactly is sleep apnea? As you can see, it's very obvious that this person over here is snoring, making noises while they're sleeping, and their partner over here doesn't seem to be enjoying them. But I think a lot of people who've heard of sleep apnea think it's the same as snoring, but it's not just snoring. Many of us, whether it's ourselves, whether it's our partners, whether it's our friends or family, we have heard snoring before, which is a noise when people are sleeping. But sleep apnea is not necessarily just snoring. The word apnea actually means to not breathe. But sometimes when people are snoring really loudly, all of a sudden they stop breathing and it sounds like they're gasping for air. So it's not just the snoring noise, but actually like they're gasping for air, they're holding their breath, or it sounds like they're choking. And for those people who have heard that before, who have experienced it, it could kind of be a little scary. And people who are experiencing it themselves may, have this choking or gasping sensation and then wake up from it. So a lot of people who snore may be waking up multiple times throughout the night. Sleep apnea, or the full name is obstructive sleep apnea. We call it OSA. It's an official diagnosis. It's a medical problem. There's a couple of classifications, but basically it means that throughout the night, you've had more than 5 non-breathing or apneic events per hour of sleep. So for every hour of sleep that you have, that means not only are you just necessarily snoring, you're actually holding your breath. You're not getting oxygen. You're not getting air into your lungs. And this could be a big problem. What exactly causes sleep apnea? How do I get it? What's the issue here? This is a long list of different things that can cause it, but the most important ones, the yellow ones. A lot of times sleep apnea can be caused by your anatomy or like the actual structure of your neck. So we know people who are obese or overweight or have large, thick necks, they are at high risk of developing sleep apnea. And that's just because of the anatomy. When you're lying down, when you're trying to sleep, all the fat in your neck, all like the muscles and the skin, they're basically pushing downwards, right? With gravity, they're pushing downwards as you sleep, and it's going to make it harder for you to breathe. Some people have large tongues, and there's medical issues that can cause large tongues. Some people might have nasal polyps, which are like little cysts inside of your nose, or you may have like a septal deviation or something in your nose that may cause sleep apnea. And then in kids, sometimes some of you may have had kids who also snore or have some sleep apnea. And the biggest cause of this for kids is actually enlarged tonsils. So a lot of kids may have enlarged tonsils, in Spanish anginas, that actually may cause kids to snore at a young age, which is not normal. And then also as we get older, the skin and the muscles and the fat in our body get a little floppier, as we like to say, and that can also cause sleep apnea as well. So as you can see right here and kind of in the picture, the biggest risk factor is a large neck circumference. Circumference is the measurement of your neck around the entirety of the neck. So we actually get one of these like flexible rulers and we wrap it around your neck and we measure it. And if you have a neck that's larger than 40 centimeters, that's a really big risk factor for sleep apnea. But there's a lot of other things that can cause sleep apnea. So a family history, if you have people in your family who snore or have had this problem before. Smoking is a really big problem. Alcohol. So again, I kind of talked about how like obesity and larger necks can be floppy. It weighs against your neck. But when you drink alcohol, your muscles also relax. The muscles in your neck, the thing that keeps your neck open, are relaxing, and it pushes down on your neck. And that floppiness is what causing the snoring. That's why in the last slide, it's called obstructive sleep apnea. There's an obstruction in your neck and it's causing you not being able to breathe. So you're like, and then you're snoring, and then it like the floppiness is it's weighing against like the airway and it's preventing you from breathing normally when you sleep. Sometimes thyroid problems, if you have any thyroid issues, that can lead to sleep apnea. And then people who may have had strokes in the past or other brain injuries, that may cause your brain to not breathe appropriately while you're sleeping. How do I know if I have sleep apnea? So these 4 stars, these are kind of like the hallmark symptoms. These are like the classic symptoms that we see with people who might have sleep apnea and that we might want to evaluate. So do you wake up with headaches in the morning? Do you wake up just feeling like, oh, I just did not sleep well, I have a really bad headache in the morning? And then are you tired throughout the day that you can't explain it? It's like you have coffee, maybe you thought you went to sleep early. Oh, I went to sleep at 9 p.m., 10 p.m. last night, but you're still tired throughout the day. That might be a sign that you're not getting enough oxygen to your brain at night, that you're waking up a lot from the sleep apnea or different reasons. Maybe your partner or someone in your household says that you snore really loud. And like I talked about earlier, you're waking up really frequently. Those are also like classic for sleep apnea. And then we'll talk a little bit more about this, but high blood pressure. pressure. So sometimes we see people in the clinic who are very healthy otherwise. Maybe they have like a good lifestyle, but they still have a high blood pressure. I wonder why they have a high blood pressure. Well, sleep apnea, if you're not getting enough oxygen to your brain, if you're not breathing appropriately while you're asleep, it's actually a big risk factor for high blood pressure. Let's say you think you might have it, or let's say you're concerned about it, or you want to ask your doctor about it. So this questionnaire on the right side is what we use in the clinic to determine who should be tested and who shouldn't. So it's called the Stop Bang questionnaire, which is kind of a funny name, but it helps us remember because it's an acronym. So these are the 8 things that we ask you about. So snoring, do you snore loudly? Have someone told you that you snore before? Tiredness, do you feel overly tired during the day? Are you fatigued? Like maybe you went to sleep early, maybe you didn't think you were waking up, but tiredness throughout the day. Observed apnea. So this is kind of what I was saying, like, has anyone told you that when you're sleeping, they hear that choking noise, that gasping, that that means like you're not getting air through your throat. And that's, apnea. Has someone told you about that? High blood pressure. Do you have high blood pressure? Have you had high blood pressure in the past? Are you currently being treated for high blood pressure? Are you taking medicine for hypertension, which is the other name for high blood pressure? BMI, which stands for body mass index. This is kind of how we measure people's level of obesity or if they're overweight. And more than 35 is what we consider to be very obese. So we do consider that as a risk factor for sleep apnea. Age. So I talked about as we get older, sometimes our neck and our muscles get floppy and are not able to hold open as well. And then neck circumference, we already talked about that. So again, neck circumference greater than 40 centimeters is probably the biggest risk factor for sleep apnea. And then lastly, gender. If you identify as a male, if you are a man, there is data to show that men are more likely to develop sleep apnea than women. So then based on these questions, we give you a point and then we determine, are you low risk, intermediate risk, or high risk? And then depending on these factors, it's going to determine who should we test. This itself does not tell you necessarily if you have sleep apnea, but is a questionnaire to help us determine, do we think you might have sleep apnea or are you at risk for sleep apnea? So these are kind of all the things that we're looking for. How do we get tested? The first thing is if you're concerned about this, or if you've been told that you snore, your partner says that you snore, or perhaps you had one of those symptoms like the headaches or the tiredness throughout the day, first thing is to ask your provider, your doctor at your clinic to do the Stop Bang questionnaire. This will help evaluate if you're at high risk for sleep apnea. Then the gold standard test for sleep apnea, the best way that we determine if someone has it is by doing something called a polysomnography. It's a very long word, a medical term, but it just basically is a sleep study. So once you see your doctor and we think that you might have sleep apnea, we're going to send you for a sleep study. Usually, the majority of the time, sleep studies happen at a clinic where you have to go and you have to spend the night overnight at this clinic. It's kind of uncomfortable because you're sleeping in a place that's not your home, it's not your bed, and then they're going to hook you up to all these wires. We put kind of some detectors around your nose. We put these wires kind of all around your head. And what we're doing is we're measuring not only your snoring and how many times you're holding your breath or having the apnea at night, but they're also looking at your brain activity and making sure that there's no brain causes that may be causing your sleep apnea, right? So they're kind of looking at a couple of things and looking at your brain and also looking at how well you're sleeping. So people with sleep apnea typically don't get full sleep. You probably heard about the different stages of sleep and like REM sleep and all these different sleeps, but your body is not able to fully get like a restful sleep if you're constantly waking up, if you're constantly having sleep apnea. So these are things that we're evaluating with a sleep study. Insurances usually do cover it, but I think I would definitely ask your doctor if you're covered to get a sleep study. And then treatment, this is the most important thing. So sleep apnea is actually very important to get treated. It can cause a lot of downstream problems, and that's why it's important to think about this and take this seriously. It's not just snoring, it's actually a medical problem. So the biggest thing you can do is, like a lot of things, is lifestyle changes. So weight loss, obesity, and larger neck circumferences are risk factors. They're probably the most important risk factors for sleep apnea. So making sure that you're eating healthy, exercising, and trying to lose weight, because the more weight that you have around your neck, the higher chances you are of having sleep apnea. Improving your sleep routine. Sleep apnea can cause tiredness, and sometimes tiredness that's unexplained by other things. But if you're someone who's going to sleep late, you're watching a lot of TV or screen time before sleep that can ruin your sleep, or maybe you're having coffee or sodas and caffeine late in the day. All these things can cause you not to sleep well. You want to make sure you get a full restful sleep or not waking up throughout the night. So this is really important as well. Cutting out alcohol and smoking. That's probably the biggest thing I can recommend. Eating healthy and exercising is obviously very important, but it's kind of hard to make those changes. The biggest change you can do right now, if you think that you have sleep apnea, is cutting out alcohol and smoking. We know that both of those things are risk factors for the floppy neck that I talked to you about. And you may have heard before that if you drink alcohol, that the nights that you drink alcohol, your snoring is way worse and you're going to be gasping and having more problems. Making sure to manage other medical issues or medications that you may be taking. Another thing that can actually make you have sleep apnea is maybe you're taking medications that are making you too sleepy and you're making your muscles too relaxed. So we see this sometimes with people who may be taking chronic opioids for pain. Maybe they have cancer pain or other chronic pain. And sometimes those medicines can make you sleepy. Or maybe if you take muscle relaxers, you might be taking muscle relaxers for like an injury or muscle problem. So lifestyle changes is going to be the number one thing that you can do right now to both prevent it and treat sleep apnea. But the gold standard way that we do treat it is called a CPAP machine. You might have seen this before. It stands for continuous positive airway pressure. People will sleep with this machine next to their beds. And basically what the CPAP does is it kind of humidifies water into vapor. So that's kind of easy on the lungs. And it sends the air to this mask and kind of to your nose and your mouth. And that way, when you sleep, there's constantly air going through your throat and it helps keep that airway open. So you wear it every night, you wear it to bed, and it seems uncomfortable. It probably is uncomfortable to many people at first, but you start getting way better sleep. If you are experiencing sleep apnea or have snoring, everybody who uses the CPAP says that they improve their symptoms. They stop having morning headaches, they stop feeling tired the next day, and they just get better sleep. And then overall, this is going to help your long-term health. So we know that sleep apnea and snoring is really, really bad for your high blood pressure. It's going to keep your blood pressure elevated, and then that's just going to spiral into a bunch of other health problems. We know that high blood pressure leads to heart disease, it leads to strokes, it leads to all these other things. So sleep apnea is something that we can actually control and treat, and it will help prevent a lot of long-term health problems in the future. This is just one testimony, but my dad, he has used it all his life. He got so used to it. He just basically cannot sleep anymore without his CPAP. And if for any reason he sleeps at night without the CPAP, the next morning he feels terrible. He says he can tell when he didn't get a good enough sleep. So it's really important to use the CPAP machine. And my mom, who sleeps next to my dad, she says that now the CPAP machine is like a white noise for her. It helps her sleep too because it does make a little bit of a noise. So whenever like my dad's not there, it's harder for her to sleep, which is kind of funny, but it does make a big difference. There are a bunch of different types of CPAP masks. There's different types, and you can try to find out which one would work for you, because I know some people find them uncomfortable. So there's some that only go through the mouth. This one's called a hybrid. There's some that are full face, kind of like in that last picture. This one's only in the nose, and this one's also in the nose. So there's different kinds of masks, and you can try to see which one feels more comfortable. But in the end, the most important thing is that it's opening your throat and your airway, and it's preventing you from having these events. And then the last thing I'm going to talk about today is kind of the connection to the theme. I know we've been kind of talking a lot about respiratory problems, but kind of like we're saying, sleep apnea, you're not breathing. You're not getting air into your lungs. You're not getting oxygen to your lungs. So naturally, it makes sense that it's going to exacerbate or make worse some of your other lung problems. If you think you have sleep apnea, if you have it, it's really, really important, especially if you have some of these lung issues. So asthma and chronic asthma, COPD, which is caused by smoking, pulmonary fibrosis, which can be caused by a bunch of different things. It can be genetic, but other lung diseases, maybe you have cystic fibrosis. And then lastly, long COVID. We know that long COVID can sometimes cause some long-term damage to your lungs. Any of these chronic lung diseases, it's especially important that you get treated for sleep apnea because you're already not getting enough oxygen to your lungs. It's really important. And then, like I mentioned earlier, these are other medical conditions or diseases that we have to look out for. So high blood pressure, hypertension, sleep apnea does make blood pressure worse. So if you have hypertension, if you're at risk for it, this is something modifiable. This is something that you can take care of to try to help with your blood pressure. And then people who have heart failure have a lot of breathing difficulties. We talked about strokes or other neurological conditions like multiple sclerosis, muscular dystrophy, and then also people who use certain substances. So if you use alcohol frequently or chronically or different sort of opioids, those may also put you at more risk of not breathing enough. It's just really important to have good lung health. This is my name. We see both adults and kids. If you are one of our patients, please come see us again, or if you're not, we're happy to always see you and we can talk more about sleep apnea and different lung conditions. We're right here on 106 and 3rd in East Harlem. And then you just call our office and you can ask to see me or ask to see one of our doctors.
Are there alternatives to CPAP?
I always say this to my friends. I think whoever can come up with the new solution for sleep apnea, for snoring, that's not CPAP is going to be the next millionaire, because unfortunately, like the CPAP, it's kind of clunky. It's not the most easy solution and
Sure.
it's uncomfortable. It's not easy, unfortunately, but there are innovations and devices that they're trying to create. So some people have tried this before. So this
Somebody
may be
was
something to
mentioning.
try, like a nasal prong. So
Mm-hmm.
sometimes people like will put tape, or sometimes like these little tubes that you stick in your nose and that helps keep your nose open, and that may help with the airway. These may help. I think it's worth trying. There's nothing wrong with them, but I just want to be clear that like the only medically approved solution, the best solution we have is the CPAP. There are other things I think being built, devices and stuff like that, but right now there's nothing like guaranteed that will work. These new devices that are coming out may not be approved by your insurance until you try CPAP. So either way, most likely your doctor is going to recommend CPAP and at least trying it before exploring what else is out there. I think some people actually have sleep apnea and snoring that has to do with congestion. Like some people may have a lot of like congestion in their nose or their throats, especially during the winter months. So I think like a room humidifier can help with congestion. But if you have like medically diagnosed sleep apnea, the pressure of the machine is actually keeping your lungs open. We have like these little bubbles, and that's where like the oxygen exchange happens. And the CPAP is actually providing that pressure to keep your lung open and make sure that you're getting enough oxygen to your body at night.
So it's that direct pressure that is helping you to breathe when you might not be breathing otherwise.
It's so important that we get really good sleep for a lot of reasons: high blood pressure, all these respiratory stuff like we talked about. And there's actually doctors who are sleep specialists.